House Health Policy Committee will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter.
She's on Zoom.
Hadsma.
Here.
Neely.
Here.
Glanville.
Present.
Kofia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingens.
Here.
Vanderwall.
Present.
Mueller.
Here.
Filler.
Yes.
Sorry.
They're so tall now. Threw them all out of whack there.
Van Workum.
Here. Do I get to be part of this?
Schmaltz.
Here.
Ron.
Oh, Roth, sorry.
I'm here.
Schmaltz.
Here.
Thompson.
Present.
Madam Chair, you have a quorum.
Thank you. Representative Conlon moves to approve the minutes from our meeting on March 2nd. Seeing no objection, the minutes are approved. Today we will be hearing testimony on House Bill 4167, introduced by Representative Jason Morgan to establish a Rare Disease Advisory Council. Representative Morgan, welcome to Health Policy. Please come forward and you can start when you're ready.
Thank you so much, Chair. It's interesting to be on this side of things so soon here in the legislature. Thank you so much, Chair, for first holding this committee meeting and hearing us today. This is something that is extremely important to me personally, but also to so many people across our state. Thank you all for listening to us. Thousands of Michiganders suffer from rare diseases, including myself. Although I started developing muscle tightness and soreness that is typical of Becker's muscular dystrophy when I was about 11, it took 2 years, more than 2 years, to really discover what was happening with me. Once I received a diagnosis, I didn't know what to do. I faced tough questions that few, if any, of my young peers were facing. How could I accept a life expectancy that was shorter than most of my peers? How could I access the care that I needed? How was I going to live with this condition? So few in my life could understand what I was going through, and it was a very sad and scary experience. It's one that many in our state face as they're trying to understand what's happening with themselves. What changed my perspective was receiving my diagnosis around the age of 13 and subsequently attending a camp for kids with muscular dystrophy at that point. Meeting other kids who were not only living with muscular dystrophy, but thriving and finding a way to find hope filled me with hope. Instead of focusing on how long my life might be or how different it might be from others, I started to focus on how best I could use the time that I had. For those who aren't aware, with Becker's muscular dystrophy, the diagnosis generally means that you lose your ability to walk sometime in your mid-20s, and the average life expectancy is still 42 years old. Despite my youthful appearance, I am 33, and so that is a number that I think about every single day. Attending this camp, meeting other kids, and understanding how to process what was happening with my body gave me a sense of purpose. It's ultimately what motivated me to run for office. It's why I'm here with you today. Today I'm asking myself different questions, though. What I'm asking as a legislator is, how can we better support those with rare diseases? How can we make what can be a harrowing process more bearable for patients and their loved ones? How can we better educate healthcare providers? It's possible to live a rich and fulfilling life with a rare disease. My life is proof of that. However, we need to provide patients, their families, healthcare providers, and all of those who love these folks with the necessary support and resources. That's where the Rare Disease Advisory Council comes in. The goal of the Rare Disease Advisory Council isn't necessarily to provide a solution to the problem of rare diseases. It's to understand the problem, and that starts with listening. Listening to healthcare providers, patients and their loved ones, medical professionals. The support that I needed as someone with muscular dystrophy and Pinconning is going to be very different than someone living in Detroit or Grand Rapids with cystic fibrosis. We need to understand the different resources that different patients need. My bill can't promise to treat or cure rare diseases, but what it can do is help us learn about the problems that patients with rare diseases face. What are the common obstacles to care? How can we ensure doctors are educated about these diseases? These are the questions that deserve answers. And with your support, I hope that the Rare Disease Advisory Council can provide them. So I'll stop there, but simply share that I'm very, very open to questions. This is something that's been worked on for a couple of years and passed the House of Representatives in November of 2021 with strong bipartisan support by 92 to 12. So this is something that's been talked about for some time and just didn't make it over the finish line last session. And I'm so honored and happy to be the person bringing this forward to all of you with the hope that we can move it forward in this legislature. Thank you so much.
Representative Morgan, thank you so much for sharing your personal story. It's very meaningful to me and I'm sure others. And I appreciate the other people that you've helped coordinate, which we'll hear from in a moment. I do want to give opportunity for questions directly for you. Representative Reingans.
Thanks for being here, Representative Morgan. I see that there has been an appropriation in the DHHS budget for $70,000. Do you have a sense of what that funding would go for or be used for?
Yes, I do. And so there was an appropriation made with this previously with the goal of making sure that we are not putting any undue burden on the department. So wanting to make sure that we're funding the staffing necessary for that. The folks serving in this council are not paid, so it's not going to, salaries or anything like that. But just to make sure that the department is not burdened by what we're asking them to do.
Vice Chair Whitsett.
Thank you for sharing your testimony. I'm glad to know your story. I myself have Lyme disease, which of course is sometimes considered a rare disease. So I understand the struggles. Everyone's struggle is different. So I really appreciate you bringing this forward because navigating the system and having that support system when it comes to something being considered rare is very hard to find. So I think this is going to be a great asset, and like you said, for people who are in Detroit, in other areas, that you're bringing them together. So I appreciate it.
Thank you.
Thank you, Vice Chair Vanderwall.
Thank you, Madam Chair, and thank you very much for being here and testifying in front of us today. Just a couple questions. One, it lists right now that you have 22 members on there, and my question is, 22 members gets to be a sizable group of people that when you put that many people in a room, I don't really know how you'll accomplish the goals that you want. So first off, are we stuck with the 22? Are we looking that we could vary that a little bit? Or do you feel the importance of everybody that you have on there is what we really need? I'll let you answer that one first, and then I have one more after that. But thank you for being here, and it's all yours. Thank you.
Thank you, and thank you for that question. You have some history with this legislation, being around previously. Yeah, so that is a concern that we've looked at over the last few months here as we've been working on this. The size of the council was previously 26, and I absolutely agree with you. A body that large can get complicated. What we worked through over the last few months is making sure that we have diverse perspectives at the table. So it was very important to us not to have simply one entity or one group at the table on this committee. So it would include patients, parents of those with patients, pharmaceutical folks, medical professionals, a researcher, essentially everybody within the system of healthcare in the state of Michigan related to diseases, to make sure we have all those perspectives there. One of the things that we've reduced the membership by 4 already. At a later date, the plan is to bring a substitute to you all as well, which would shrink that a little bit more because we were able to discuss in the meantime, between the time of bringing this forward and having subsequent conversations with stakeholders, we found a couple of other folks we could remove from that simply to make it more manageable. In short, we're hearing the feedback, incorporating it, and that is something we'd hope to bring forward before actually passing this.
Very good, thank you. And Madam Chair, if I may, the last part of my question would be, when you bring a large group in and you develop the criteria of how they're going to manage this, what controls are we willing to put in place for outside monies that may be introduced by organizations that would like you to study their rare disease or to look at that? Just curious what your thoughts are on that and how we would deal with that with this group.
Yeah, in terms of the focus of the group, the committee, you'll hear a little bit more from other folks who are joining us, but the intent is for this to look at a whole range of rare diseases, to learn about what those diseases are early on, and then to think through recommendations for care, really focused on the patients. I'm not aware of particular money that would come in. I guess if there are folks that want to help support this work, I'm not sure how that works at the state level, but I think our goal would be for this to not be disease specific, but really focusing on researching a couple of diseases per year and providing recommendations, but overall looking at care issues, information gathering, and then information sharing.
I appreciate that, and I love your answer there. And then, if I may, one last one. What is the goal of the committee of how many diseases that you would try to attempt to look at each year?
So that would, I guess I would leave that to the committee specifically, because I don't know what what they will feel that their capacity is. There are so many different rare diseases that they could research. And the goal is for this to work over time. You can't look at every one of them all at once. It just isn't possible. I think it would be more than one, but probably a handful each year where they could dive in, do a little bit of research, understand what the system of care is, essentially from the point of diagnosis or even before diagnosis until the end of care for somebody with a rare disease. So speaking specifically for muscular dystrophy, what would have helped me is making sure that doctors in rural communities like where I grew up were aware of what muscular dystrophy is and the many different ways that it can present itself. It was somewhat dumb luck that they figured out it was muscular dystrophy after a couple of years and then tested me. And so you'd really have to, each disease is so different that they'd have to just tackle a few at a time. And then the hope is that this work would continue long into the future so we can get to a broader range of diseases over time.
Thank you. Again, thank you for bringing this bill forward. Thank you.
Thanks.
Thank you. Representative Glanville.
Thank you, Madam Chair, and thank you, Representative. I echo the comments here, and thanking you for bringing this forward. I, too, have a rare disease, Ehlers-Danlos. I don't know if people have heard of that, but it is similar to your story. I was not diagnosed until maybe, let me think, about 10 years ago, maybe? Less than that, 7 to 10. And it was, like you said, dumb luck. It wasn't even dumb luck. Luckily, I had a physician's assistant in my primary care office who was working it's one of those things where you just have all these things that present over time and you don't realize they're connected. And there was one person who wanted to figure it out. So here we are. So I appreciate that. I appreciate the minority vice chair's questions about the controls and things like that. As you were discussing that, I heard you say something about having diverse viewpoints on the committee, and I'm wondering, as we look at the folks who are being appointed, if there's a way to expand those definitions to ensure that there is equity. We want to make sure we have folks from various racial backgrounds, socioeconomic backgrounds, that sort of thing, because the way they experience disease can be quite different and have, based on their, the social determinants of health that we talked about last week, how that affects their livelihood is also presents very differently. And so I'm hoping that, like I said, maybe we can expand this a little bit just to make sure that those things are covered, because it's easy to say, oh, we'll do that, but having it in the list would be helpful. So I guess I don't really have a question, just a suggestion, but thank you again.
Could I respond to
Sure.
it? So, Representative, actually, that is something that that our chair brought up in our conversations, and it was a really good question. And so, one of the things we've looked at is perhaps adding language that would specifically say inclusive of diseases that impact a broad array of populations. So, making sure that it is being inclusive without making it exclusive by any means.
Well, and not just the disease type, but like I said, how those diseases affect, I mean, from your story too, like I was in northern Michigan, so this is a very different process for me than somebody in an urban area where they might have access to, you know, more medical facility and things like that. So
Yeah.
thank you.
Thank you.
Representative Fitzgerald.
Thank you, Madam Chair. I'd like to just first start by asking, and first, thank you very much, Representative, for being here today and for sharing your personal journey with your own rare disease. I want to drill down on really the goal of the council. Really, there's a discussion here about continuum of care. Mortality rates may be an unintended consequence, but really a benefit to this, you know, trying to decrease the mortality rate of some of these rare diseases because of the work of the council. But really, the language of the bill really talks to access and connecting people to this information. And I have a follow-up following this, but if you might just kind of dive deeper into the ambition and the goal of the council itself from that perspective.
Yeah, absolutely. The initial goal is to gather information and to listen to patients, because I can certainly speak to you to my rare disease, or several of our colleagues here who've shared their that they are living with rare diseases. Thank you for that, by the way. It is not always easy to share when you're impacted by something that people may never see or notice. So the goal is to gather information, to listen early on, but then to be thinking about that longer term perspective of how are we caring for people longer term. We don't really do this work at the state level, or at least we haven't. It happens at the federal level in a way that I've been very involved in on the advocacy space for many years, but we've never really played a role in that. And there are diseases that specifically impact Michiganders and differences of how you access care, as Representative Glanville was talking about. If you grew up in rural Michigan, where I grew up, you have a different level of specialty doctors and doctors with different levels of knowledge about a variety of diseases, or imagine the UP or somewhere like that, where you have an even different perspective compared to Ann Arbor, where I live now, where my primary care doctor is the University of Michigan, which is where I attended as a kid to really understand my muscular dystrophy. So listening and learning first, I guess I would say, with the overall goal of improving long-term quality of life and life expectancy. One tiny example I can share with you is I would have never known the potential impact on my heart if I didn't know about muscular dystrophy. Because I know that, I have a heart exam every year or every 2 years, depending on how well the one from the year prior goes. Some years it's not great, and I have to come in the next year. Other years it seems like it's doing okay, and I can do a couple of years. That will extend my life expectancy. At some point, I will go on medication for that. That will, I won't get into the details, but I hear it reduces some of your energy level, and I don't have any to spare right now, so I'm holding out as long as I can. But you know, so it will literally extend your quality of life if you know that you have some of these diseases, because you can then receive treatment. So I don't know if that fully answers your question.
It does provide good perspective, and if I may, Madam Chair, I have one follow-up, and with your example of your personal diagnosis and the potential delay that you had between the ages of 11 and 13, how would this information, and maybe this may be deferred to the council itself, but how would this information be disseminated or more readily available to, say, a more rural or remote medical facility and care providers to eliminate some of that delay? And we talk about the expediency of care and also the continuum of care. How would that take place in concept with this current council, or this proposed council?
Yeah, that's exactly it. So the goal of the council is to first prepare and consolidate information about rare diseases impacting Michigan residents, and then helping gather information on how to identify those things, different treatment methods, and things like that, to be able to share as an advisory body within the Michigan Department of Health and Human Services, ideally, but then they can share that information broadly across the state. I can't give too much more specific of an answer of that, because ultimately there's a lot we don't know, and we hope this committee, this council, will gather that information, learn more, and identify some of these solutions that frankly don't exist currently. Most simply, I would say sharing that information once it's gathered with physicians across the state, health centers, and families, to make sure that they're aware. I think that is probably the most simple, granular level to that answer, but I think there are more options out there that this council will be able to identify.
And our last question for Representative, and then we do have 3 more people that need to testify. Representative Miller.
State Representative, thank you so much for coming forward, because I know this isn't easy. And I am so surprised to hear from so many of you that have these rare diseases, and I'm one of them. I suffer from multiple sclerosis. It's a horrible disease, and the symptoms are very similar to yours. And I experienced them for years, and I had no idea what it was. And my niece, she suffered from juvenile Huntington's disorder. It's the worst disease on the face of the earth. And what I learned through those experiences is the lack of support. You're overwhelmed. You're told your life is going to be shortened, that you might pass this on to your children. And although all those things are real, we have to deal with that daily, and you hide it, and you keep it to yourself because you don't want to be judged. And you're afraid to apply for a job because you're afraid you'll be labeled with that. That's the reality. But on the other side of it also is there's no support groups for these rare diseases. I know that firsthand because I looked for those support groups. How can you help with that through this bill?
That is precisely why we want to convene this council, is to look at what are some of those supports that can be offered or shared or convened around some of these diseases, because each of our diseases there's some similarities. There's similarities in terms of what we lack in terms of support, but there are also differences in terms of what we need. So one example, again, I feel you'll hear from others speaking to some other diseases, because I can speak most directly to my own experience, is that I had a care coordinator at the University of Michigan for some time when I was a kid. And they would coordinate all the different appointments and what I had to have checked out each visit. It was literally somebody saying, your disease doesn't just impact your arms or your legs, it impacts your heart, your breathing, your neurological, every part of your body. And they would coordinate all of those different appointments that are extremely difficult quite frankly, for me to even understand where to go. That was funded through a grant. It doesn't exist anymore. So now I just sort of have to figure it out myself. But things like that could be looked at to say, okay, you have MS or you have this other disease. What are the other symptoms that you may be feeling, or other parts of your body that might be impacted? And how can we understand that better to provide that care? I don't know if that's something that would come out of the council. I don't want to prescribe what they would do. I think I would leave it to the experts to sort through that. But that's just one example of an idea of where we could better support coordination of care.
Through the chair, if I may, one more question. Would you be willing to serve on this board, on this committee?
Thank you for that question. I think we would leave it to, yes, I don't think I'd be able to.
Separation of powers.
Yes, so I would not be able to as a legislator, but I know we have some really amazing people that you'll hear from, a couple of which you'll hear from today, who would be phenomenal. But we would not make those appointments under this structure. The way that we've structured it is that it would be a completely apolitical body. So it would be under the Department of Health and Human Services, because honestly, I don't want us politicians appointing people to this body that should be based on medical and lived experience. I think they would make some good recommendations and good decisions there, but we'd want them to be making those decisions.
And if I may.
I'm sorry, we have to move along, Rep. Miller, but thank you for your comments.
Thank
and
you.
Rep. Morgan, if you could stay up there, I think we have some questions, but I want to get to testimony first. So if you can just stay and we'll have another person join. So to speak in support of the bill and provide a perspective on the diverse but shared challenges for the variety of rare diseases, we have Anissa Reed from the National Organization for Rare Disorders joining us remotely. Welcome. Oops, hold on, we can't hear you. Just a second. Try one more time.
Can you hear me?
Yes, thank you. Welcome.
Okay, perfect. All right, good morning, Chair Rogers and members of the House Health Policy Committee. My name is Anissa Reed, and I am the Associate Director of State Policy at the National Organization for Rare Disorders, or NORD for short. NORD represents the estimated 25 to 30 million Americans, including 1 in 10 Michiganders, who are living with a rare disease. I'm honored to testify today in support of HB 4167, legislation creating a Rare Disease Advisory Council, or RDAC for short, in Michigan. We're grateful to Representative Morgan for his introduction of HB 4167 and for being a real champion for the rare disease community. It can be difficult for state lawmakers to have an in-depth understanding of the rare disease community's needs due to small patient populations and the variety of rare diseases. This lack of awareness often contributes to the obstacles faced by rare disease patients and their loved ones. An RDAC is an important tool that can help fill that gap. The Council may conduct surveys to better understand common challenges rare disease patients or caregivers face, consult with experts to improve access to quality health care, and compile resources related to rare diseases. In creating this council, Michigan would be joining 24 other states that have already enacted similar legislation in support of their rare disease community and proven that it is an effective way to ensure better government engagement and action on issues of importance to the rare disease community. Once again, thank you for adding HB 4167 to the House Health Policy Committee's agenda and for the opportunity to testify. I urge the members of this committee to support this legislation and swiftly pass it out of the committee. Thank you.
Thank you. Do we have any specific questions? I do have Representative Schmaltz if you had a question for Rep. Morgan or the speaker either.
It's more just a comment.
Sure.
I think you're an amazing person, and I've heard your story before because we've talked about it. I'm glad you're doing well. And I think this is so needed. My question had to do with the makeup of the council, which you had already answered that question. But it's so important, as we know, the mental aspect of having a rare disease affects your physicalness too. And having a council like this, I believe, would give people more hope, which is what they need when they're facing something like this. And as we heard from just people on this committee, how many people go through a rare disease that we don't even know about. So I appreciate you bringing this, and I'm glad. It's so wonderful to see somebody step up like you and help others so they don't go through what you did. So thank you.
Representative Conlon.
Yes, thanks, Representative Morgan, for sharing your story, and to all of my colleagues sharing their stories. I'm just wondering, I'm seeing here, I'm wondering how the information gets out. I see that there would be sort of research and recommendations given in a biennial report so that we can not wait a long time to learn, because if this body gets together for the first time, they might have recommendations very quickly. So I just hope we can have action points along the way. I'm wondering what we've seen, if you know, from the 24 other states that have this kind of legislation, and how that has worked in terms of maybe influencing laws or helping with their health and human services.
Perfect. Yeah, I'm happy to answer that question based on what we've seen. So typically, the council's the first step is to survey the community to get an understanding of what are the patients in the state's needs, the providers' needs, the caregivers' needs. And since there's such a diverse group of folks on the council, a lot of them have a way to kind of distribute that information, whether it's through different clinics, whether it's through patient organizations. So we've seen states like Pennsylvania collect thousands of responses over the years from their community. And they look at that and they say, okay, what are the issues that folks in our state face? And also keeping those meetings open so people have the opportunity to consistently share their story so the council can hear from others in the community. So it's really, we've seen a team effort, but we've seen amazing outcome in making sure that those voices are consistently heard, where otherwise they, like what's been said, there's really not a platform where they feel that they can speak and share their experience.
Thank you very much. Next up, with insight into how the establishment of a Rare Disease Advisory Council will support research into treatments and therapies, we have Dr. Stephen Rapundolo, President and CEO of MischBio. Welcome.
Good morning, Chair Rogers, members of the House Health Policy Committee. I'm Dr. Stephen Rapundolo, President and CEO of the Michigan Biosciences Industry Association, or MischBio. We're the statewide organization that represents the interests of the biotechnology and pharmaceutical, medical devices, diagnostics and testing, healthcare information technologies, all the academic and clinical research, along with professional service providers and suppliers and contract research and manufacturing organizations that support them. Our bioindustry is one of the largest nationally, and its mission is to innovate and develop products, treatments, and therapies that improve and save lives for the patients we serve. And MischBio sits at that interface between the innovation industry and patient groups, many of which are members of our organization. And as such, our role is to inform, to educate, and partner in support of patients' needs for better access to meaningful health care. I encourage all of you to move House Bill 4167 through swiftly and begin to bring relief and attention to the many rare disease stakeholders in Michigan burdened by daily challenges with no effective solutions. We have a tremendous potential to make positive changes through the RDAC that'll benefit not only public health challenges and by extension cost expenditures for the state, but improve patient quality of lives for those diagnosed. It would provide a sorely needed opportunity to recognize, investigate, and then implement changes accordingly, which could benefit the whole rare disease community. And I'm confident that an RDAC can deliver on its stated mission. As you just heard, many other states have implemented such advisory bodies since 2015, and several have delivered reports with policy recommendations on how to mitigate access and affordability issues facing rare disease patients and caregivers in their regions. But closer to home, Michigan already has a model for the proposed RDAC, and that is the Community Values Advisory Board, or CVAB, for the Michigan BioTrust for Health. The BioTrust is a DHHS program that oversees the state's newborn screening and stored blood spot program and their use in public health research. Now, the Community Values Advisory Board is a 15-member group appointed under the authority of the DHHS director and represents the public voice in development and operations of the BioTrust. And I've been privileged to be a member of that body since its inception some 15 years ago and have served as its chairperson for the last 4. And a variety of stakeholders. We have representatives across the state from underserved and underrepresented communities like Indigenous and minorities, professionals with backgrounds in genetics and hospitals and healthcare, legal and bioethics, medical technologies, and even public and environmental health, as well as slots filled by the general public. And we all convene to provide counsel on the governance of the BioTrust, communication and education for engaging and informing mothers and parents about newborn screening, and on ethical issues, including patient-informed consent and what types of research are or are not acceptable uses of the dried blood spots. And that group, much like that proposed for the RDAC, brings to light insights from a spectrum of backgrounds and experiences to ensure that the program and resources are impactful parents, newborns, providers, and public health generally. In fact, there can be strong synergies and overlaps between the two bodies for mutual benefit. So to close, I would suggest that a greater focus on rare diseases through the formation of an RDAC is critical and of value for 3 primary reasons. First, rare diseases are not rare. As you've heard, each individual rare disease affects fewer than 200,000 people, but there are over 7,000 rare diseases and growing. All of us are touched in some way by a rare disease: a child, a spouse, a parent, a sibling, family member, a friend, a work colleague. Second, and at its core, a formal structure of a legislatively established RDAC will benefit the Michigan legislature as it develops impactful policy solutions for challenges affecting the rare disease community. And lastly, studying, researching, and developing cures and therapies for rare diseases benefits rare disease patients, of course. But rare disease research and development generates rich dividends for broader disease populations. Insights into the genetic causes of rare diseases, for example, helps build knowledge about the human genome generally and the genetic connections and misconnections underpinning the causes and mechanisms of diseases broadly. Furthermore, it can be a catalyst for biomedical discovery and innovation at our research institutions, as well as commercialization and development of new treatments and therapies by new and existing Michigan companies, all of which help sustain and grow the statewide biosciences industry. So thank you for your consideration.
Thank you for your testimony. Do we have additional questions? In addition to anything else that's been shared, can you just expound upon how you would see the Advisory Council supporting research in Michigan?
Well, I think one of the best ways will be by the group identifying, as you've heard from folks from NORD, as well as Representative Morgan, the diverse experiences of the rare disease population here in Michigan, and understanding where perhaps there might be areas that need greater focus, identifying who in the research community is working in those areas, and if not, what can be done to bring some of that insight to our community. So, you know, we have a rich research community. I mean, there's no question that there are many that are already working in the rare disease space and working on new treatments and cures like gene therapy and things like that. So I would imagine the council would bring all of those kinds of insights together and try to determine how best to, what strategies to move forward with.
Thank you. Representative Fitzgerald.
Thank you, Dr. Rapundolo. Appreciate your testimony here today as well. This question could be answered by either of you. One thing that I feel is not necessarily explicitly mentioned in this bill, but may be, again, a suggestion of the committee, is the financial impact of this and the cost of care. We have seen clearly a push with insulin costs, for example, of those being capped in reality with the cost of care for those with diabetes. Do you think that this may be something that could be incorporated into the suggested legislation from this council back to the legislature, seeing as these drugs that may be affecting one of these 7,000 rare diseases may not be produced at such a mass rate that it would impact cost or be prohibitive in cost to those needing the care or needing the drugs?
Certainly, I can. I can't speak explicitly to drug costs. That's a little outside of my expertise, but I can speak to the what I suspect would be potential cost savings over time. I mean, for me, it was 2 years of testing about every month, blood draws, different theories explored of what could be wrong with me, countless hours back and forth to doctors' offices across the state, and ultimately a lot of wasted resources just trying to figure out what was wrong with me, and different treatments that were attempted. If we could streamline that, help people figure out what's happening earlier, I think you could actually see cost savings in some ways to making sure that providers have a better understanding of how to identify some of these diseases. As for the drug and pharmaceutical side of things, I suspect there are some opportunities there, but wouldn't want to speak outside of my expertise.
I think, over the last few years as this legislation was introduced and discussed, there certainly has been discussion about generally and broadly having the council look at access and affordability. And yes, at the level, for example, of these new gene therapies and all that, our payment systems yet aren't structured to necessarily accommodate those on a consistent sort of level on par with traditional treatments. But there's more nuanced issues related to affordability. I know we've heard from patients who have to get to a center of excellence for their rare disease, which in some cases may be out of state in neighboring states, but Michigan Medicaid will not pay to cover those travel costs as they are in other states. So, you know, there's a whole range, I think, of affordability issues that I'm sure will probably come to light once we get more information as to what are the top issues for the Michigan population.
Thank you so much for joining us today. And finally, we will be joined by Laura Bonnell, founder of the Bonnell Foundation and mother of 2 with cystic fibrosis. Welcome.
Thank you so much. Hello, and thank you, Chairwoman Rogers and members of the House Health Policy Committee. It is a pleasure to join you today and to share my support of House Bill 4167 and legislation to establish the Rare Disease Advisory Council in Michigan. My name is Laura Bonnell. I have 2 daughters, Molly and Emily, who both have cystic fibrosis. Cystic fibrosis is a progressive genetic disorder that impacts the lungs, pancreas, and other organs. And individuals impacted by cystic fibrosis experience a variety of symptoms, including coughing, frequent lung infections, difficulty breathing, and a shortened life expectancy. My daughters are 28 and 25. They have outlived their life expectancy. When they were born, it was 19, so hooray for that. And a lot is changing in the cystic fibrosis community, which is wonderful, but we still have a long way to go. The average life expectancy right now is 52 approximately. Roughly 1,100 adults and children are currently living with cystic fibrosis in Michigan, and these individuals receive specialty care at one of the 7 sanctioned cystic fibrosis hospitals throughout our state. Yet, unfortunately, many individuals living with CF still face challenging barriers to care and treatment to maintain their health. Many patients experience delays in treatment due to insurance protocols such as step therapy and prior authorization. Step therapy is a requirement for patients to fail on a cheaper drug first before being approved to take the drug that your doctors prescribed, causing risk of relapse for patients with CF and other rare diseases. Prior authorization requirements often delay access to medications that may also lead to the deterioration of patients' health. My own daughter recently experienced the risk of a delay in her access to life-saving medications after she was released from the hospital. That was very scary and completely unnecessary. In 2010, I started the Bonnell Foundation, Living with Cystic Fibrosis, and throughout the past decade, I've heard countless stories of challenges like ours. People are overwhelmed by a system that oftentimes is not working to their advantage. The challenges that my daughters face and others with cystic fibrosis are not unique to them and often shared by the 1 million Michiganders currently living with a rare disease in our state. I've realized that raising my voice as one person does not get me very far, but together, the entire rare disease community, our voices can be heard. The Rare Disease Advisory Council is so important because it gathers all the stakeholders so we can work together to solve issues such as step therapy, prior authorization, and challenges that impact people, their health, and their lives. We understand that the healthcare industry is large and complex and without all the answers. However, this council will create a dedicated space to share information and discuss the best ways to support Michiganders living with rare disorders. If you don't know someone with a rare disease in your life, at some point you will. And we hope that you will support House Bill 4167 and the creation of the Rare Disease Advisory Council, the voices of 1 million rare disease patients in Michigan. And we're doing this for the future of our children, grandchildren, and beyond. And I just want to, again, I know we've said it before since we've been sitting here, thanks to everyone who spoke about their rare disease. I know there are others of you here that have siblings and other members that have rare diseases, and it's really important. It is refreshing to be here. It is refreshing to see you all. This is wonderful because we are all in the same boat, and this council is going to help so many people. There isn't anything bad about it. It is just to get all of us together so insurance companies can say, hey, I don't think this is going to work. And then we can say, oh, but this is why it's a problem. And then the insurance company may say, oh, okay, I get it. All right, let's do this. And then when we get the question from the lawmakers, we'll say, oh yeah, we talked about that, and then here's our recommendations. So that is a wonderful thing as we see it. And the other thing that I wanted to talk about and elaborate a little bit on what Rep. Morgan said is that it will be impacting all the rare diseases every year. So every time we get a question from a lawmaker or we're discussing something, it will impact every rare disease. As those of you know with rare diseases here, you know what prior authorization is, and you know the challenges that happen. You know how detrimental step therapy is to your life. You understand it. So that's the reason that we're all getting together in this group, so that you can't know everything. You don't know about all 7,000 diseases. So that's why it's important that we're all together so we can give you the information you need. And then on drug costs, I think there's one good example too that's really important. Like from the pharma side, everybody is not totally anti-pharma, but they're like, lower your prices, lower your prices. And I just want to remind you, in the rare disease community, if you lower every price, the rare diseases will not be helped. If the pharmacy cannot recoup what it needs after spending billions of dollars on drugs that fail, if they cannot recoup their money, there will be no Trikafta for my daughters for cystic fibrosis. There will be nothing coming down the pipeline in the future if we don't work together and make sure that, we're figuring this out and being respectful and responsible to everyone. So
Thank you so much, Laura. Are there questions? I see Representative Mueller. I'm sorry, it's been a long 24 hours with very little sleep. And thank you. I just want to highlight with your, not to point things out, but with your special accoutrement on your shoulder, thank you for being here today. We
Still
appreciate
have
it.
one good arm, so. Yeah. To the point of the medication, I mean, as you know, my sister has cystic fibrosis, and she's 52 and had a double lung transplant. Maybe explain exactly how much it costs, because I know how much, like, for her, for a little bit of time, it was over $30,000 a month for medication.
I have two girls, yeah.
And so, we were very fortunate when my sister was born in 1970. She was diagnosed with cystic fibrosis in like 74. I was about ready to be born. My dad happened to be in the legislature at the time. And, because he was, we were able to survive, because if he wasn't, we would have had to sell our farm. So it is a big deal. I mean, she's since had a double lung transplant and is doing pretty good. And she's, like I said, she's 52, almost 53, but her medications are through the roof. And she spent almost 8 months in the hospital waiting for her lungs, and that hospital bill was millions of dollars.
Right. And lung transplants aren't even covered, even today, by health insurance completely. So you have to raise money while you're in the midst of this. But yes, in answer to your question, both my daughters are on Trikafta. It's $330,000 for each daughter per year, and that's just the one medication. My daughter wakes up and does 8 medications in the morning. So yeah, there's a lot.
Thank you so much, and thank you to the group. We are just about at time. I want to thank everyone for being here, especially members of the committee on a no attendance, no voting day. Thank you for coming in today. I do have some cards to read in. So in support of HB 4167, we've got Kelly Waters. We've got Wayne County Prosecutor Kim Worthy, who apologizes for not being able to, I think she's got double duty today. I think she's testifying over in the Senate on something else, but we appreciate her support. She is a mom to a daughter with sickle cell, so thank you so much for your card of support. Nate Filler from Boehringer Ingelheim, USA, in support. Adam Carlson from Michigan Health and Hospital Association in support. Beryl Mansky from the Cystic Fibrosis Foundation in support. Lily Melander from Bio. Ted Piper from PTC. Ryan Bertha from Novartis. the Hemophilia Foundation in support, and also Teresa Waters, who's a physical therapist. And I just would like to say, as a point of personal privilege, as a physical therapist for over 20 years, I myself have picked up on some of these strange collection of symptoms. We have the privilege as physical therapists to often spend 45 minutes to an hour with individuals 2 or 3 times a week for multiple weeks. And sometimes as the practitioner that spends the most time with them, we pick up on a lot of these odd constellations of symptoms. So as someone who's part of that medical team, I appreciate Representative Morgan bringing this forward, because I think more people do need to have the awareness of these strange constellations of symptoms sometimes actually have a name and a diagnosis, and getting through that laundry list. Oftentimes it's the diagnosis of last resort. Sometimes you have to go through all these other things and rule out. So thank you so much. We have no members to excuse, and without objection, there being no further business before the committee, we stand adjourned.